5, 4, 3, 2, 1.
You're listening to Plutocracy Now. Today we're talking about healthcare, Obamacare, and the health insurance industry. You're listening to Joey Hornbuckle.
I'm Tez Ricklin.
Scott Brown.
Bridgman Bolger.
All right, so here's what I think about Obamacare and health insurance in general. And this goes into a little bit of the history of the health insurance systems. Health insurance systems generally cannot exist without significant government intervention. You guys agree?
I love the government.
All right, good. So whether it's single payer, whether it's private insurance, if you don't have the government getting in there big time, it just doesn't work. So in World War II, the government set up a set of incentives, there were tax incentives for employers to buy their employees health insurance. And ever since then, we've had a system that basically works for us.
Except that it was an arbitrary decision by random bureaucrats, or maybe just a bureaucrat at the IRS. It wasn't unintentional.
Yes, it was kind of a mistake. It was the IRS making that decision because at the time there were price controls on income, and so employers wanted to know if that price control also related to health insurance, and the IRS said no.
Thank you, IRS.
Yeah. So over time, this system was beginning to fail because healthier people didn't want to stay in a health insurance system because they were paying more into it than what they were getting out. So in the 1960s, there was a reform with Medicare and Medicaid, which got people who were disabled and elderly off of the normal health insurance rolls so that everyone else could pay lower health insurance. And also, the main point was so that the elderly and disabled would have health insurance. So there have been some other reforms, but by the time that Obamacare was coming about, there were, again, too many healthy people, too many people leaving the health insurance system, which was causing costs to go up for the people who are still in the health insurance system, which is causing even more people to want to leave, which was beginning to create this spiral where eventually everybody would leave. So what Obamacare is a set of subsidies and penalties written into the tax code to better incentivize.
I'm going to tell you what Obamacare is. It's all the bad parts of socialism without any of the good parts of socialism.
It's not socialism at all. It's just making sure
they're forcing me to get. I have to get health insurance.
So we have tax incentives for businesses, tax penalties for businesses, tax incentives for workers, tax penalties for workers to get you to buy health insurance and to get your employer to buy you health insurance.
But why? I'm a vegan. Why? I'm healthy, man. I'm like, I don't...
Because if everyone's not paying in the health insurance system, then it becomes more inefficient and eventually it collapses.
I know that. I understand. But no, here's what I'm saying. This is why this is all the worst parts of socialism, because everybody has to pay for it, but not everybody. Like this. Why don't we just have single payers? Like, what the hell? You're mad Obama.
Everybody would have to pay into single payer too, Scott.
Huh?
Everyone would have to pay into single payer too.
Yeah, I know, but it's got benefits that Obamacare doesn't have.
Like what?
The government has the power to set prices and negotiate hard with the industry.
Okay, now let me tell you why this is a bad idea. When the government starts controlling prices for new healthcare products, that means that they're able to lower what the price would normally be, and that means that for healthcare innovators, they no longer have the incentive to invest in projects that create new medicines or new healthcare products because the price of that product would be controlled and they wouldn't be able to profit. This doesn't mean that scientists don't want to do it. It means that investors aren't going to invest in a healthcare company if it's not likely to be successful.
Investors are not going to invest in anything that's going to help people instead of helping them get sick. That's not what the medical industry does. They keep you medicated to perpetually keep you sick for as long as possible until you die to make as much money off you as possible. So the powers that be in the corporations at these healthcare corporations, they don't care about the general welfare of the public. They, just like any other corporation, they care about how can we make as much money. So there's no incentive for them to invest in research that's going to lose them money. Why would they do that?
This is why I'm saying this is one industry that should be socialized. Because if you look at the incentives of it, how does the profit incentive line up with getting people not sick. I mean,
it doesn't.
Exactly, it doesn't. So that's
doesn't.
why this is like, according to the logical laws of capitalism and economics, this.
I compare our American healthcare system to the American auto industry. American cars, they're made like shit so you can keep buying parts. You buy a Japanese car, it runs forever. 400,000 miles on the engine. You buy an American car, they purposely put inferior parts into their products so you can keep buying parts, therefore they can make more money. The healthcare industry in this country, they give you bad medicine that makes you more sick so you can buy more medicine that's going to make you sicker for longer, and they're going to make money from you the whole time.
Well, Bridgman, I think you have a point. Joey, I think you also have a point. Some of the money that we spend on healthcare does go back into research and development. However,
Holy shit.
But Bridgman also has a good point too, because here's what happens with research and development money. The NIH funds grants. They go out, they do medical research.
Basic medical research.
And what do we get? We might get a very expensive cancer drug you spend $100,000 on for maybe 3 months, maybe a year, who knows? And on average, it gives people 2 more months of life, right? That's not the kind of healthcare Americans need. People aren't dying in this country because they don't have a $100,000 cancer drug. Like, that drug does not add value to our healthcare system. Like, that's great if we could afford it. But you know what? We can't. We can't afford to give everybody the most expensive medicines. And if the most expensive, if this innovative medicine is providing such a low value, then, we probably shouldn't buy it.
All right.
No, so here's my problem with the way that you guys want to control prices. When you control prices, this doesn't just mean that you're preventing medicine that's bad for people. It means you're also preventing the good medicines from being developed too. And the fact of the matter is, if you control prices, you will limit profits, you will limit investment. That will slow down innovation. So when you regulate prices, you slow innovation, and more people wind up dying or suffering from health problems.
What is the level of productivity in the healthcare sector, Joey?
What kind of question is that? Productivity how?
The productivity in the healthcare system is flat.
Sick people getting well.
Sick people are getting well more often over time. I mean, you look at cancer survival rates. They are, in fact, much higher today than they were 10 years ago or 20 years ago.
That's because people are living better lifestyles, though.
No, I mean, people who get diagnosed with
the technical advances in the last decade.
People who get diagnosed with cancer are more likely to survive today because of these healthcare innovations that came about from the ability for these healthcare companies to profit. Thanks to Big Pharma.
Do they need
and thanks to the NIH.
Do they need to profit as much as they had? Do healthcare prices need to be as high as they are in order to have these benefits?
Joey,
to
the
society?
whole reason we pay twice as much for our healthcare system as most other first world nations, and the reason we've got the worst care out of all of them in general,
we don't have the worst care.
On average. Out
of industrialized nations.
Our mortality rate...
We have a problem with giving everybody insurance, but people who have high-quality insurance have really good health care.
At least your buddy fixed that. But still, you know what he didn't fix? My
buddy Obama did fix that. You're right.
No, your buddy,
I'm glad you recognize that.
your buddy Obama dealt with the access problem, which is that's one side of it. But the other problem is price controls. I mean...
Price controls
he just gave the insurance companies a big present. But it's a big present for the corporations.
No, everybody has to get health insurance.
Joey, hold on. Let me give you some facts.
All right.
Square this for me, because this is hurting my head right now. Bring it on. Combining this with what you're saying. All right, so one Lipitor pill in the United States costs the same as that of 3 in Argentina. One Plavix pill in the U.S. costs the same as 4 in Spain. One Nexium pill in the U.S. the same as 8 in France. Why do we not need price controls? Why is this a good thing that we pay 8 times as much? Why is it a good thing that we pay
I would like to,
every dollar helps every American.
Because we invested
every
back
dollar
into
you
nothing.
give to a corporation really comes back and like actually saves the economy money.
No, here's the reason why. Because on average today, it costs $1.3 billion. That's as of 2005, according to the Tufts Center for the Study of Drug Development. It costs $1.3 billion to develop the average drug today. That is expensive. And I want to point out your boy.
How much?
$1.3 billion. And this is a risky business because most medications, most of them fail in the early trials. So I want to bring up Bernie Sanders. I want to paraphrase him. He pointed out, he said, it's not fair that the United States pays so much more for healthcare to pay for the research and development of the world when it comes to healthcare. And he's right. We ought to do things to get other countries to pay more for their medications too.
We've also got some benefits.
Oh, so you want to everybody else over? You want everybody?
No, because we shouldn't be the only ones taking on the burden.
Yeah, well, all right. Well, look at this. I mean, all right, this is getting beyond healthcare, but I mean, it's the same thing with like carbon emissions. I mean, why India's saying they don't want to put a carbon cap, why China's saying they don't want to put a carbon cap, because we in America have been benefiting off that for so I mean, there's sort of being on the technical cutting edge, it has its benefits and its drawbacks.
I mean, we're the richest country, and we're certainly sacrificing a lot more in this area. So Joey, I get it. But
I got a question for you.
All right, ask it.
All right, so if these these medical innovation companies need all these profits to innovate and save lives and all this,
they need the profits so that investors will invest in them.
Why is it the Medtronic, one of the top medical technology companies probably in the world, but it's one of the top. They spent
they're great.
Why? Yeah, they're awesome. I wonder why they want to corrupt my government. Let's see, they spent in 2012 alone. They spent money on hundreds of congressional candidates. In the House, they spent $59,000 on Democrats alone, and Republicans $82,000. In the Senate, $38,000 to Democrats. In the Senate, $26,500 to Republicans.
Is this per candidate?
Why do they spend in? No, this is total between.
Probably because they want more funding for the NIH, so there'll be more basic research for them to take on with applied research and development, so they can make more profits.
Oh, they're so philanthropic.
They want to make profits, and that means that we have more medicine. So it's a win-win situation. Yeah, but of course it is.
All right.
So is there any point at which higher inflation in the healthcare sector has negative effects on the American economy, Joey?
Well, yeah. I mean, it's certainly not something that we would want, but at the same time, for that research and development to happen, you have to pay for it. And trust me, it is worth it.
Joey, the biggest contributor to our national debt right now is healthcare.
Yeah.
What do we do? What?
No, but that's worth it. We're spending more money on Medicare because we have more products for people to buy that are healthcare related, that are allowing them to live longer and live healthier.
We got a lot more shitty products too.
Okay, yeah, but if you got a product that's going to let you live.
But my point is that price controls are not the way to solve it. Not through Medicare, not through the private markets.
Then what's the way to solve it, Joey?
To solve the price problem? There's a lot of things that we can do to cut on costs without doing price controls.
And they're all in Obamacare.
No, not entirely, but some of them are. All right. So I jotted down a few ideas. The first one is health information technology in the private sector is already creating savings and changing how our healthcare system works by getting more information about patients and about the medications, about everyone else.
That, Joey. But
okay, all right. So that's one way. A second way is we need to give full funding to Medicare Part B. We need to spend more money on Medicare Part B because it's causing for private insurance to be more expensive in order to subsidize the shortfall in Medicare Part B spending, which is, of course, doctors, things like that. Another thing, yes, the Obamacare law does, in fact, empower the federal government to make several reforms in the future, especially to cut waste.
What about...
to address the problem you're talking about, we should outlaw promoting drugs and medical devices to doctors or on television and replace it with more health information technology.
So you want to limit advertisement?
Direct-to-consumer advertising is only legal in the United States and New Zealand.
See, the thing is, I'm okay if you want to do something like bringing awareness to a certain kind of disease or something that you may have, like
restless leg syndrome.
Yeah, I mean, who would have thought of that, right? So, but to just do it with medications. The thing is, right now, pharmaceutical companies spend more money on advertising than they actually do on research and development. So, if you can replace the system that we have now with something that's more centralized and information based with the health information technology.